we at Frederick have known for a long time that a lot of our oncology treatments are driven by some of the genetic findings. And, that aside from just that oncology use case scenario, we've also jumped into the world of pharmacogenomics where, we're able to run a 25 gene panel to take a look at what the most common genes that help you metabolize drugs. So what question are we trying to solve with that? How does your body react to this medication, or how will it supposedly react to it? And what side effects do we anticipate?
Now you're bringing to full realization the precision medicine, right? I mean, that's coming front and center.
Yeah, and that's affecting everybody. That's from birth to death.
Exactly.
You don't need to be a certain age to have that test done. You don't have to be on certain medications to have that test done. It can identify folks who may not even be on a medication that, 10 years down the road may be having chest pain and end up in the emergency room with a myocardial infarction. And, the natural treatment plan would be to give you an antiplatelet agent such as clopidogrel. And if you have that certain genetic makeup where you're a fast metabolizer of that medication, and the cardiologist goes in to place a stent, you would potentially be at risk for a complication called in-stent thrombosis. And so that could be a very tragic outcome, less than a week after you had this life-saving procedure. And identifying that. So, we've identified that this is the gene makeup that you have. How do we put that data in front of our doctors that are taking care of the patients? That's the ultimate problem. How does it fit into your day-to-day workflow so you're not referring to a PDF buried in a lab section? I don't have time for that. The ER doc definitely doesn't have time to go take a look for that. So, how do we get that in front of them? There is something that we've used with partnership with our genomics module and First Data Bank called Clinical Decision Support. So I'm the doc, I'm typing in clopidogrel to prescribe that for my patient. And that patient 10 years ago had that genetic testing done. I'm going to get an alert. It's going to be a big red triangle that says, this patient is a fast metabolizer of this medication. We would recommend medication XYZ or an alternative. So that is hitting the docs, to give them that warning in real time. That is where the workflow benefit of employing this technology in our EMR now is super helpful.